Today we are going to study gastrointestinal bleeding. Etiology, it depends upon the site. It is upper GIT bleeding or it is lower GIT bleeding. The most common cause is ulcer diseases in upper GI bleeding, and lower GIT bleeding it is diverticulosis. The other causes are esophagitis, varices, duodenitis, gastritis, and cancer. And in lower GIT bleeding, it may be polyp, IBD, inflammatory bowel disease, upper GI bleeding, hemorrhoids, and cancer. Physical findings include orthostasis, which means there is increase in 10 points in the pulse and decrease in 20 points in the systolic blood pressure while from lying position to the sitting position or from sitting position to the standing position. And the percentage of the blood loss is 15 to 20%. If pulse is more than 100 beats per minute, then 30% of the blood is lost. And if the systolic blood pressure is less than 100 mmHg, then 30% of the blood loss has been occurred in the patient. Whenever a patient comes to us with variceal bleeding, the following signs and symptoms are looked: vomiting blood with or without black stools, that is melena, spider angiomata and caput splenomegaly, palmar erythema, and astraxis. The initial management is done, which depends upon the severity of the bleeding. First of all, pass 2 wide bore IV cannulas and protect airway and pass NG tube in order to prevent aspiration. The following investigations are done side by side, which include complete blood count, blood typing, and cross-matching PT, APTT-INR, coagulation tests, and do fluid therapy. Normal saline and ringer lactate is given in case of acute and severe bleeding. Packed RBCs is given when hematocrit is less than 20 to 30. In case of young patient, it is 20 range, and in case of old patient and having coronary artery disease, then the hematocrit must be less than 30. Fresh frozen plasma is given when PT and INR is increased and there is acute bleeding. Then platelet is also given if the platelet count is less than 50,000. Prophylactic antibiotics is given in order to prevent the spontaneous bacterial peritonitis with ascites. Proton pump inhibitor is given. Octreotide and terlipressin is given, which decreases the variceal bleeding by decreasing portal pressure. Then endoscopy is done, which tells us the site of the bleeding. And then depending upon the site, band ligation, sclerotherapy, or injection epinephrine is given. After doing endoscopy, if there is no bleeding, then secondary prophylaxis is given, that is beta blocker propranolol is given, which will stop the bleeding. If there is early rebleed, then again the endoscopic therapy is done. And if this will not work and there is recurrent bleeding, then TIPS is done. Whereas whenever there is continuous bleeding, then black mode balloon tamponade is done, which is a temporary procedure, and until if there is bleeding, then TIPS is done, which decreases the portal pressure and is the permanent treatment. But the side effect of TIPS is hepatoencephalopathy, which is treated by giving lactulose.